You look at the data of ever-increasing obesity and diabetes, and you just think, maybe we're being told the wrong advice.
We've been told forever that fat's going to kill you.
There's incontrovertible evidence that saturated fat is bad.
Over and over and over. You're fat because you eat too much fat.
So low fat, low fat, low fat, low fat, low fat.
It's hard to think of another policy that has caused so much harm, that has been so wrong.
I think the food pyramid is great if you're standing on your head.
Should be called the food tombstone.
I mean, the manipulation of the data and the push for low fat really got us in trouble.
I just gorged myself on all these carbohydrates and it was toxic.
I think the low-fat diet is genocide.
Hi everyone! So what was the first thought you had after seeing this? Any guesses? Come on, let's think. Yes, absolutely, it's about weight, our body weight. But still can't guess exactly, isn't it? Okay, I'll give you one more clue. What happens if our body weight is excessive? I hope you get it this time. Yes, it's about obesity.
Obesity is due to excessive accumulation of body fat, usually caused by the consumption of more calories than the body cells can use.
But most of us confused between being overweight and obesity. Overweight is under moderate condition, it is not necessarily obesity. The differences are, for overweight people, their BMI is greater than 25, and for obese, their BMI is greater than 30. BMI is called body mass index, which measures the weight related to height. It is a common way to estimate our body fat.
Here is the categorization of our body mass index.
I have an interesting fact to share with you all. Let's give a simple workout to our brain. Do athletes consider as obese since they have higher BMI than normal people? The answer is no. This is because their muscles are more denser and heavier than their fat, which puts them at higher BMI. So they may often considered as overweight or obese based on their BMI alone. But the truth is, the excess muscle puts them at higher BMI, so they may actually considered as obese.
There are many risk factors for obesity. Some of the risk factors can be changed, such as unhealthy lifestyle and environment. Some other risk factors, such as age, genetics, race, and sex, cannot be changed. For unhealthy lifestyle habits, lack of physical activity, unhealthy eating patterns, not enough sleep, and high amount of stress can increase your risk of obesity. Lack of physical activity due to screen usage has been associated with a high body mass index. Also, some unhealthy eating behavior can increase your risk for overweight and obesity. In addition, high amount of stress can cause hormone changes that can make you eat more and store more fat. For the irreversible risk factor of obesity, one of them include family history and genetics. Genetic studies have found that overweight and obesity can run in families, so it is possible that our genes or DNA can cause these conditions. Research studies have found that certain DNA elements are associated with obesity. As for sex, women tend to store less unhealthy fat in the abdomen than men do, so that is why females have a higher risk of getting obesity more than men.
Thank you. Now I would like to present on the diagnosis of obesity. So the first diagnosis is body mass index. For most adults, having a BMI of 18.5 to 24.9 means you are considered to be a healthy weight. Someone with a BMI of 25 to 29.9 is taken into account to be overweight, and someone with a BMI over 30 is considered to be obese. BMI may be a useful measurement for many people, but it is not accurate sometimes. So for example, the conventional BMI score might not be accurate if someone is very muscular, because muscle can add extra kilos and so on. So for some cases, your waist circumference also can be a far better guide to identify our BMI. And finally, the diagnosis for the obesity is visiting your general practitioner. So if you're overweight or obese, we can visit a general practitioner for advice about losing weight safely, and to search out and whether you've got an increased risk of health problems. So for example, if you feel like you are gaining weight and you are eating too much, you can visit your general practitioner to get some ideas or tips on how to reduce the weight step by step. So if you visit your general practitioner, they can give you advice on the physical activities that you can do, and how to have a proper balanced diet to reduce your body weight. So this is how a person with obese can take initiative on how to reduce their weight in future.
Assalamualaikum. So today I'm going to interview Dr. Adriana to ask about the prevention of obesity. Let's go. Assalamualaikum. Doctor?
Waalaikumsalam. Yes, come in.
Good morning, doctor. As we know, the rate of obesity is getting higher day by day, right? So what actually we can do to prevent this problem, doctor?
Yep, the fact that obesity prevalence continues to increase at an alarming rate in almost all regions of the world is of major concern. Hence, there are some steps to overcome it. The prevention of obesity involves action at several levels, including primary, secondary, and tertiary. The objective of primary prevention is to decrease the number of new cases. This can prevent development of overweight and obesity, such as educating the public, promoting healthy eating, and regular physical activity. The secondary prevention is to lower the rate of established cases in the community. This can prevent future weight gain and development of weight-related complications in patients with overweight or obesity. For example, we can screen and diagnose using BMI and evaluation for complications. Lastly, tertiary prevention is to stabilize or reduce the amount of disability associated with the disorder. They will be treated with weight loss therapy to eliminate weight-related complications and prevent disease progression. For example, we can treat the patient with behavioral interventions plus weight loss medications and consider bariatric surgery.
Thank you so much, Dr. Adriana, for today's interview.
No problem. In conclusion, obesity has reached epidemic proportions, and it is a new challenge to public health professionals, as it is one of the main risk factors for several chronic diseases. Understanding the role of environmental factors on development of obesity helps in control and prevention. Prevention of obesity, such as healthy eating combined with increased physical activity and promotion of health education, should receive high priority.
Thanks for watching.
Thank you for watching.